So welcome everyone to Ahead of the Curve, a webinar discussing how comprehensive vendor monitoring mitigates risk. Our speakers today are ProviderTrust co-founder and managing partner, Chris Redhage, as well as Katy Harvey, who serves as our vice president of the provider segment. Today, we're going to be discussing a little bit about vendor monitoring. We'll end with our final thoughts. It's going to be a Q&A session with Katy and Chris, and we'll also take some questions from the audience if we have time. And with that, I'm going to turn it over to Katy to get started.
Thank you. Hi, everyone. Thanks for joining. And hello, Chris. I am excited to have this conversation with you today, really focusing on the responsibility healthcare organizations have to monitor vendors and vendor owners to meet the federal and state exclusion monitoring regulations. And we are really here to learn from your experience in this space. So as we get started, I think it's best to begin with who and what we are going to be talking about. My first question is, what criteria or factors define a business as a vendor in the healthcare space?
Katy, while we're waiting for people to answer the question, I could give a little bit of my history. One of the reasons I actually started ProviderTrust was because I was working in a business and an individual actually embezzled a bunch of money. And I saw kind of how that impacted me. Not only on a personal standpoint, but my family. And that was one of the kind of the main reasons why I started ProviderTrust, really to try to pull or eliminate fraud out of healthcare. So interested in the results of these questions.
You see the results that just popped up, Chris. I think most of the crew is right along with what you would say, wouldn't you?
Yeah. So when you're looking at a vendor, one of the common misconceptions is that it's just in terms of healthcare, it's just someone who's working with the patients. Typically, those are described as FDR vendors or first tier downstream related entities. But actually, based upon the law, it's any vendor, basically anyone who's providing goods or services that you're paying directly or indirectly within healthcare. So that could be anyone from a lawn care person to a window washer to Cardinal Health, or someone who's actually providing instruments in a surgery. So it really is everyone kind of within your AP system that you're paying both directly or indirectly. Now, there are situations where you could work with an excluded vendor if everything is completely segmented off and there's no intermingle of Medicare or Medicaid funds, so any type of government funds. But typically, the easiest way to do this is you need to monitor all your all your vendors. And then the other next step is the owners. And this is actually where the problem is, and we see with our clients, is how do you actually collect that information, Katy? That's the hardest thing to do. So being able to not only collect and have accurate vendor information, but then to go that next level and collect the owners. And people might be asking why owners. The federal government, OIG, says anyone who owns over 5% of an entity, you need to monitor. And the reason for that is we see a lot of fraud where individuals will get excluded, and then they'll hide behind what we call the corporate veil. So you really need to not only be monitoring the entity, but also the owners as well.
And we'll talk a little bit more about that as the conversation goes on. To confirm, Chris, vendors, this includes janitorial services, food, catering. I mean, you think about the span of entities that will do business within your healthcare organization. They are all defined as a vendor, correct?
They are.
Yeah.
And again, as I said earlier, that's a common misconception where it's just anyone who's working in the medical space, but it is really anyone that you're paying directly or indirectly with Medicare or Medicaid funds. An interesting situation, we have a client prior to working with them, they had a laundry service that came in and actually was collecting patients' laundry and washing them. the entity and the owner wasn't excluded, but actually the employee was. And that kind of gets to that we'll talk about a little bit later in the discussion around not only monitoring the entity, the owners, but also ensuring that those vendors are monitoring their owners or their employees as well.
So Chris, help us kind of understand, how does vendor exclusion monitoring contribute to overall compliance with federal and state regulations?
Yeah, so this is really good. So we started ProviderTrust, and really we're monitoring for licenses and exclusions. And I would say that was in 2011 through 2015. That was really where the OIG was focused. But really over the last 5 to 7 years, the OIG has kind of began to start and say, hey, we think there's a lot of fraud over here in the vendor area. And when you look at healthcare organizations, the amount of money that flows through their vendors is pretty staggering. You know, we're looking at 18 to 20% of our GDP that is involved in healthcare, which is massive. And so if anyone's looking to commit fraud, they're probably going to go to a large area and then try to hide really in the tail. And so that's one of the reasons why, as you could see in this poll, 1 out of 5 organizations cite vendor or suppliers source as their most disruptive external fraud focus.
And, you know, it's challenging to keep up with vendors and exclusions as a whole. And just looking at the total number of excluded entities in the United States, there's over 210,000 entities that are excluded. Only 12,000 of those have an organization name attached to them at the source that we're monitoring. And then, you know, diving down a little bit more into the detail, only 2,700 have both a name and an organization. So it is really challenging to keep up with this and to determine that your vendor and that the people that are running this organization are compliant. So, you know, Chris, talk a little bit about the key challenges healthcare organizations face when it comes to monitoring vendors and vendor business owners for exclusions.
Yeah, Katie, I think an interesting point there is where you talked about how, you know, there's over 200,000 entities that are excluded, but only a certain percentage have owners attached to it. The reason for that is because when you get excluded, you're going to set up a new entity, right? And that's what makes this so hard for a healthcare organization and for our clients, is because these organizations, or these fraudsters, as we would say, are going to get excluded, but they're going to continue to go back and operate in their network of influence, right? And not everyone knows that that business was excluded or that individual was excluded. So they're just going to go ahead and set up. The other hard thing is we typically see across our clients, 20% of their vendor data changes every year. Right. So if you're not updating your business information, if you're not updating your ownership information on an annual basis, very quickly you're going to get out of compliance. And that's really what the fraudsters are looking for, is they're looking for organizations that don't have that annual program where you're constantly updating the vendor information and monitoring those vendors and owners on a monthly basis.
Absolutely. And really, let's talk about some of the not fun stuff, which is, what are the potential consequences for healthcare organizations if they fail to effectively monitor these vendors and vendor business owners for exclusions?
Yeah, typically you see civil and monetary fines. So, and a lot of these go undisclosed. The situation that I shared a little bit earlier, where they had the employee, that was actually self-disclosed by the organization. It wasn't published at the OIG, so they didn't publish that fine. But that's typically what you're looking at. The average fine, I think this year, Katie, you can correct me if I'm wrong, but I think it's $140,000 for in OIG exclusion. And so you're typically looking, anywhere between $50,000 to $140,000, depending on the incidents for that. The biggest issue, though, is reputational, right? You might be able to, you have insurance that's going to cover those fines, or you have some back payments, but now all of a sudden you're branded as a non-compliant organization. You're not keeping things up to date. So we say, there's the monetary fine that you get, but the reputational harm, will patients come? Do they consider it to be a safe place? That's really where you're looking at it from that standpoint.
Absolutely. And you already shared kind of a unique example of an organization where the employee was excluded, but let's talk a little bit more about, some examples of vendor owner exclusions that either have impacted an organization, or I know you've talked a little bit about sanctions in the past and how that can impact the organization. So let's just talk and give some examples for the folks that are attending.
This is a really good example on the screen of where an owner was actually excluded. This is an example back in 2018 where it was a community mental health facility. And what's interesting about this is there were two owners. One was the wife, the other one was the husband. The husband was excluded, but what they did here and how they committed fraud was the husband actually owned the real estate, right? And so by the direct or indirect payments, they were able to track this back to the husband, who is the individual who actually owned it. And so payments directly and indirectly were being funneled through this organization back to this real estate company. And so that's the type of fraud that you begin to see. It's a pretty complicated fraud. They're pretty smart about how they do it. And again, it's kind of in the long tail. So you necessarily, if you looked at this community health facility, you wouldn't see that they were excluded. However, if you started looking at the ownership and collected that ownership information, you'd be able to track that. So that's just a good example. Another example, actually, the very first exclusion that we ever found from owner exclusion was for one of our clients. This is probably 5 or 6 years ago. It was actually a cleaning service. Again, the wife was the majority owner. The husband was the minority owner. We collected the ownership information through our product, and we were able to find that exclusion. So those are just some of the examples of how fraud is hard to find, but it is out there. And I believe this is actually one of the biggest, one or two sources of fraud in healthcare. It's just really hard to collect the data and focus on it.
Yeah. And before we talk about, how technology can help, a lot of times we hear organizations talk about physician ownership. And while that's very important, it's not just about physician ownership. It's every owner with a greater than 5% stake in a vendor that is an organization's responsibility to monitor. Anything you want to add to that piece, Chris?
A lot of times this gets placed into the Stark law, right? Where you're looking for physician ownership or back payments, or are they paying the appropriate amount for rent? This is literally every vendor, right? So you need to be monitoring your vendors, your owners, and then ensure that those entities are also monitoring their employees as well. Katy, just one example of that is, a lot of times healthcare organizations will have contracts that push that requirement off to the vendor to monitor their employees. While that's important, and you should have a contract for that, the challenge is if that vendor has an employee who's coming into your organization and is excluded, the fines are still being assessed to you as the organization. Right. And so you might have a contract that then covers, you could go back and be reimbursed. You have insurance that covers it. But then again, you have the reputational harm around that. And then the challenge is how do you ensure that they're being monitored and that they're monitored on an ongoing basis? So when you start looking at this fraud, I would say, physician and employees, like we've got that, right? Because most organizations have their employee information, have their social security number. We can monitor that. This is the hard area that there's still lots of innovation to be had around it. And one of the areas that we're really focused on, because I think this is the long tail. As we begin to focus our light on this area, we'll be able to kind of get a lot of the bad actors out of healthcare.
And I think kind of it's timely and it's an important conversation, you know, based on the poll results, we're seeing over 50% of attendees either do not monitor vendor owners or are unsure. And I think unsure is really where we'd find a lot of the space. They may do some, attestations at the beginning of a contract with a vendor, but then that ongoing monitoring that you touched on earlier is so important. So Chris, as we talk about, there's some great questions coming in the Q&A. So I'm going to shift to those for a moment and then come back to talking about how technology can help us streamline this process. But so one of the questions is, when it comes to vendors, how do we know which ones to monitor? Is it the person who we bought balloons for an employee's birthday? You know, obviously you've referenced Cardinal Health. There's just the gamut of vendors. So how do we know which vendors to monitor? And then on top of that, how do we know which vendor owners we should really focus on?
Yeah, so when you're looking at vendors, the simple answer is all of them, right? Anyone that you're paying directly or indirectly. The challenge there is, how do you collect the information, right? So we have a lot of clients that will pay for those balloons with a credit card or something like that. It's really hard to collect that information from a credit card, because that doesn't show up on your AP payments. But really any vendor that you're collecting their W-9 from, getting all their information to be able to pay them, you need to be collecting their business information, their tax ID or TIN number, along with their ownership information. Typically what we do is we set a threshold with our clients. We say anyone that you're spending annually over $1,000 annually with, you're wanting to go through your procurement process and just at least collect their information, which is their business, their TIN, and then their ownership information as well. And again, this is all your vendors. So anyone who you're doing lawn services with, all the way up to surgical equipment, you're going to want to collect their information. The interesting thing about this, Katie, is that the small to medium-sized businesses is actually where your fraud is at, right? That's your biggest risk. The Cardinal Health, they've got a massive compliance department. They're monitoring their employees and their owners. They're a public company. That's not where your fraud is going to be. Your fraud is going to be kind of in the trickle down effect. A little fun little tidbit. We're in Nashville, Tennessee, and a lot of you all have probably heard of music and music theft and Spotify and the whole gamut around music. I have a friend who literally focuses on music playlist fraud, right? And that type of fraud doesn't happen with the massive artists. It happens with the smaller artists that are sitting there and spinning their music, right? And so that's what we have to realize is that the fraud is actually on the long tail. It's not in the middle. And that's what makes this hard.
I think that's great information. I think we're able to answer another question, which is, what information of a vendor is needed to actually have them run in an exclusion check. So, the answer always is the more information, the better. And sometimes that information is really hard for an organization to gather and potentially worth looking into a vendor to help assist with that process. I think, in my experience, the most difficult information to gather is ownership information, because it's another step, but it can be a step in your new vendor onboarding process. And that's really where one of the ways technology can play a role. So one more question, Chris. As far as owners, you mentioned one with 5% or more invested. What about the owners linked that have no investment percentage, just ownership status? Should we run those as well, correct, no matter what, since they are linked to the company? What's the risk there?
Yeah, great question. I'll share a little bit of a story during 2020 when COVID and all the Russian stuff was going on. There was a lot of sanctions that were put on Russia, and we had some clients that were monitoring their owners, or their vendors and their owners, and we were able to help them identify, do any of these Russian oligarchs own in any of their healthcare vendors? And the only way to do that is collect the information. So I share that story because the answer to that is yes. Anyone over 5%, that's kind of the threshold. It would be interesting if someone has ownership status but is not an owner. I'd be asking, are they making administrative decisions, right? Do they have some type of stock grant or things like that? So if they're making administrative decisions within that organization, the simple answer to that is yes.
And then another great question that we've received a couple times, which is, do you have to run grants, or do you have to run checks on grant recipients? So individual patients receiving grant funds, like housing assistance, that runs the gamut of what grants can be used within a healthcare organization.
Yeah, so we work with a lot of academic institutions that are getting grants from the federal government to do research. And so I would say if you're doing any type of research and those grants are coming from the federal government, anyone who is receiving those funds and being dispersed those funds for work, the simple answer to that would be yes. There are some caveats that you could kind of look through, from a patient standpoint, or if they're receiving treatments that would be excluded from a patient standpoint. But if there are researchers and they are receiving federal grant dollars for that, you'll want to monitor those.
Yeah.
My guess is that that's probably included in the grant information in the research grant. So if you kind of look into the fine print, the federal government is pretty good on including those in those really long grants.
Yeah. Really, really long. So let's talk a little bit about how technology can play a role in streamlining this process. And then I think, we got another question that I'd love to touch on as you share some best practices. So we'll start with just, overall, how can technology help those that are in attendance today and out in the healthcare ecosystem?
Yeah, so the biggest thing, and again, this is, we're not trying to sell here. We're just trying to share how we have gone and solved this problem. So on the left-hand side, a lot of the questions that have been asked is, what type of information do you need to collect? So you could see business name, TIN number, phone, email. The other things that we're able to verify is the legal business name, any DBAs, and that's through collecting that ownership information. So typically when we're working with a client, they give us a business name, the TIN, phone number, email, and email then goes out. They go through the sign up process and we collect the legal name, the DBAs, we validate the TIN and address. This is where we actually collect the ownership information. And then we actually allow the vendor to upload their employees as well. We don't ever share that information with our clients. That's the vendor's information, but we can ensure that it is being monitored. And so that's really kind of the process. The other thing that's really important is that you're doing it on an annual basis, right? So you're collecting this information on an annual basis so that then you could make sure that you're monitoring them, make sure the data is accurate. And as Katie mentioned before, the same frequency that you're monitoring your employees, you need to be monitoring your vendors and owners and their employees as well. And so the federal government, if they come in and they're looking at it, they're going to look across the board and say, are you using the same criteria for your internal employees that you are with your vendors and owners?
So then, we talked a little bit about what information is helpful, but what can be used as proof of ownership, Chris? What information would we want to see from a vendor to ensure that, we're capturing that greater than 5% ownership stake?
Yeah. So what's great about technology is it continues to keep improving, right? So the answer today is this information is self-reported. They're going to report any of the ownership information of the vendor self-reported. They typically tell the truth on that, but I'm sure there are fraudsters that have wisened up. What's interesting about this is the federal government actually just passed a law which is kind of tied to COVID and the COVID, where it's basically saying there's no way to have businesses that are where you're not disclosing your owners. And so as that begins to roll out at all the states, we'll actually be able to validate ownership information with the businesses. Today, that's a little bit hard, but it is self-reported data. And then you just monitor the owner along with their social security number to ensure that they're not excluded.
And I think as a whole, as we kind of come up at on the end of our time, just, general best practices, number one takeaway that you want to share with those in attendance today, how can they continue to implement an efficient and comprehensive vendor exclusion monitoring program?
Yeah, I think, Katie, the answer to that is pretty simple, right? But also complicated because it's across an organization. Simple, you need to monitor the owner, you need to monitor, the vendor, there are 10, you need to monitor the owner, right? And if they are an FDR vendor, you could even force them to monitor their employees as well. What's the complicated thing is over here on the right-hand side, is this vendor data touches a lot of parts within your organization. So compliance, risk, AP, procurement, finance, legal, audit, right? And so one of the great things about this is if you get this process right, you can eliminate risk and improve efficiencies across all these departments, which is really fun. So when we have clients that are really bought into to the process and what we do, we're able to eliminate the risk, drive down their costs, and make them ensure that they're really efficient around that.
And I think my best practice definitely is to start early in your relationship with a vendor, collecting this information, set the stage that this is going to be an ongoing request, and then actually continue with the ongoing monitoring and updating of this information. We had a couple of questions for follow-up information. That poll question is up now. If you'd like any of the information we shared today or additional kind of guidance on where we get these topics from, I know that OIG can put out very lengthy documents as well, something about the federal government. So we'd be happy to share and support some resources and provide the slides as well for those in attendance. We really, really appreciate everyone that joined today. Thank you for such a thoughtful Q&A. It made the conversation fly by. And, this is an important topic. It's not one that's going away. And we're going to be looking to expand upon the different topics of vendor exclusion monitoring as the year goes on. So keep an eye out for some new topics and new ways that you can continue to monitor your vendors and maintain a really healthy compliance program. If you need anything, please reach out to us, and we really appreciate your time today. Thank you so much for all the information, Chris. It was awesome talking to you.
Thanks, Katie.